All right, welcome to the deep dive. Today, we're going to get into some pretty heavy stuff, but also, I think, some really fascinating stuff. We're going to be looking at how culture, sexuality, and spirituality all play a part in palliative care.
Yeah, these are really essential aspects of end-of-life care, but they're often overlooked or misunderstood.
Exactly. So we've got a ton of information for you, the learner, and what we're going to do is try to connect these different areas and give you, hopefully, like a really clear understanding of how they all kind of weave together.
Right, so whether you're working in healthcare or you're just curious about these topics, our aim is to help you understand how to better care for people at the end of their lives. And hopefully you'll have a few aha moments along the way.
That's the goal. So let's dive right in.
Feels good.
Okay, first up, culture. Now, we hear this word all the time, right? But what does it actually mean in the context of caring for someone?
Well, I think it's important to start with a good definition. One of our sources describes culture as kind of like common origins, the customs, the ways of living, the shared identity, and the language of a group.
Right, like the common thread that binds people together.
Exactly. And another source defines it even more broadly, including learned behaviors, beliefs, values, enjoyments, ideals, skills, tools, customs, and even institutions.
Wow, that's a pretty comprehensive definition.
It is, and it shows how culture really touches every aspect of our lives. And then we have this definition from way back in 1871 by Edward Tyler. He describes culture as all the knowledge, beliefs, art, customs, language, rituals, taboos, ideas, and institutions, including things like burial and wedding ceremonies.
So it's not just about where we come from or our ethnicity, but it's really the whole way we experience and interact with the world.
Absolutely. And it's something we all have. It's not just something other people have. We all have our own unique cultural background.
Right, and that's why it's so important for healthcare providers to be culturally competent.
Exactly. And cultural competence, according to one of our sources, is basically having the behaviors, attitudes, and policies in place that allow you to work effectively in cross-cultural situations.
So it's about bridging that gap, understanding where the other person is coming from, and being able to communicate and provide care in a way that's sensitive to their cultural background.
Right. And it's a process, you know? It's not something you achieve overnight. It's a constant journey of learning and self-reflection.
So how do we actually become more culturally competent? Our sources break it down into 4 key components. The first one is awareness.
Yeah, awareness is huge. It's about recognizing that people from different cultures might see the world in completely different ways. And it's about being honest with ourselves about our own biases.
Right, like understanding that our own upbringing and our own experiences have shaped how we see things.
Exactly. And that those biases might be influencing how we interact with patients from different backgrounds.
Then the next step is knowledge.
Yeah, knowledge is about actually taking the time to learn about other cultures, specifically the cultures of the patients you serve. And it's about understanding how their beliefs might affect their health and their healthcare decisions.
Right, so it's not just about knowing like surface level facts. It's about really trying to understand their worldview.
Exactly. And the third component is attitude.
And this seems pretty straightforward, right? It's about being accepting and respectful of patients' cultural practices, even if they're different from our own.
Absolutely. It's about approaching each patient with an open mind and a willingness to learn.
And then the final component is cross-cultural skills.
Yeah, these are the practical skills that help you to communicate effectively and provide culturally sensitive care. This could include things like being able to conduct a cultural assessment, knowing the major languages spoken in your community, and being able to adapt your communication style to different cultural norms.
Right. So it's about having the tools and the techniques to actually put all of this knowledge into practice.
Exactly. And one thing to keep in mind, the learner, is that cultural competence is not a one-size-fits-all kind of thing. Each patient is an individual, and their cultural background is just one part of who they are.
Right. So we have to be careful not to stereotype or make assumptions based on someone's culture. We need to treat each patient as an individual and really listen to their needs and their preferences.
Absolutely. And all of this really highlights why clear communication is so important, especially in palliative care. When we're dealing with sensitive topics like death and dying, it's so important to make sure we're all on the same page.
Yeah. And one area where this is really evident is in how different cultures view death and the process of grieving.
Right. There's a huge amount of variation in how different cultures approach these things. Some cultures might be very stoic and reserved in their grief, while others might express it very openly and publicly.
And the way funerals are conducted can also vary widely. Some cultures might have very elaborate rituals, while others might keep things very simple.
Yeah. And the role of the family and the community in providing support can also be very different. In some cultures, it's very much a family affair, while in others, the whole community might be involved.
And even the composition of the palliative care team can differ. Some cultures might rely heavily on traditional healers, while others might focus more on medical professionals.
Right. And what's interesting, the learner, is that in some cultures, death is a very taboo subject. It's something people are afraid to talk about, and they might even avoid using the word death altogether.
Yeah, I've seen that. They might use euphemisms like passing away or going to a better place.
Exactly. And it's important to be sensitive to that. But then, on the other hand, you have cultures where death is seen as a natural part of life, and it's not something to be feared.
Like in some African traditional cultures, where death is seen as a transition to the ancestral world.
Right. And in these cultures, a good death, one where the person dies peacefully at home, surrounded by their loved ones, can actually be something to be celebrated.
And there are often very specific rituals and practices around death and burial, like specific mourning periods, symbolic clothing, contributions from the community, even animal sacrifices.
Yeah. And these rituals are all about helping people to cope with loss and to find meaning in death.
So let's look at some specific examples. In Christian traditions, burial or cremation usually takes place within a week of death.
Right. And there might be a visitation at the home before the funeral where people can pay their respects to the deceased.
And then there's a funeral service itself, which might be held in a church or a funeral home.
And after the funeral, there might be a gathering for tea or a meal.
And it's common to send wreaths to the funeral home and for the family to follow the hearse in a procession with their headlights on.
Right. And at the burial, people might scatter petals or earth on the coffin.
So moving on to Hindu traditions, the body is usually washed at home by family members.
Yeah, and they try to avoid removing any jewelry or sacred threads the person might be wearing.
And a priest might tie a thread on the body as a blessing.
Right. And cremation is usually preferred over burial, except for children under 12.
And the cremation happens as soon as possible, and the ashes are scattered in water.
And then 16 days after the death, there's a memorial ceremony with prayers led by a priest.
Now, in Jewish tradition, there's a strong emphasis on preserving life.
Yeah, so even a dying person is encouraged to eat and drink.
And after death, the body is left alone for about 10 minutes. And someone might use a feather to check for any signs of breathing.
And burial should happen within 24 hours, unless it's the Sabbath.
And it's usually a child who closes the eyes of the deceased.
Right. And at the burial, mourners will throw a large amount of earth onto the coffin.
And then there's specific mourning periods. 7 days of intense mourning at home, followed by 30 days of lesser mourning, and then 11 months before the tombstone is consecrated.
So in Muslim traditions, a dying person might want to face Mecca.
And family members might whisper prayers in their ear, and other relatives might recite prayers nearby.
Right. And after death, non-Muslims shouldn't touch the body.
And traditional washing and cutting of hair or nails aren't done.
And at the burial, the head is turned toward the right shoulder to face Mecca.
Burial should happen within 24 hours, and cremation isn't allowed.
And the body is buried in a white shroud without a coffin.
And a widow will mourn for 4 months and 10 days. But she can go back to work after a week if she's the primary provider for the family.
And lastly, in Buddhist traditions, a minister or monk from the same sect is informed as soon as possible after death.
Right. And the belief is that the spirit might take several hours to leave the body.
So the body is kept in a quiet and peaceful place for at least 8 hours, and family members are often present.
And when the body is moved to the morgue, it's done quietly and respectfully.
And the burial or cremation usually happens 3 to 7 days after death.
So the learner, you can see there's a lot of diversity in how different cultures approach death and dying.
It's fascinating, isn't it? And it just shows how important it is to be sensitive to these cultural nuances when we're providing care.
Absolutely. So let's shift gears now and talk about another important but often overlooked aspect of palliative care: sexuality.
Okay, yeah. This can be a tricky topic to talk about, but it's so important.
So let's start by defining what we mean by sexuality. It's more than just sex, right?
Right. One of our sources defines it as a multidimensional aspect of being human that includes our feelings, our thoughts, our behaviors, and our relationships. And all of these are influenced by our culture, our values, and our experiences.
So it's really a very personal and complex part of who we are.
And when someone is facing a serious illness, all of these things can become even more complicated.
Exactly. And it's important to understand that sexuality doesn't just disappear when someone gets sick.
Right. People's needs and desires might change, but they're still there.
And acknowledging someone's sexuality and their sexual needs is a crucial part of providing holistic palliative care.
Absolutely. It's about recognizing that they're still a whole person and their sexuality is a part of that.
And that need for intimacy and connection doesn't go away just because they're sick.
In fact, it might even become more important.
So what are some of the factors that can affect someone's ability to express their sexuality when they're ill?
Well, there are a lot of potential barriers. Physical symptoms like fatigue, pain, changes in blood counts, shortness of breath, incontinence, mobility issues, changes in body image, anxiety, depression, and even sexual dysfunction itself can all play a role.
And then there are the attitudes of healthcare professionals.
Yeah, that's a big one. Some healthcare providers might feel uncomfortable talking about sexuality, or they might make assumptions about who should or shouldn't be interested in sex based on age or their illness.
And then there are the institutional barriers, like a lack of privacy, interruptions from staff and visitors, and just a general lack of awareness about the importance of intimacy for patients.
Right. All of these things can make it really difficult for patients to maintain their sexual identity and to express their needs.
So what can we do to address these challenges? Our sources introduce a couple of helpful models for assessing and addressing sexuality in palliative care. The first one is the PLICIT model.
Yeah, the PLICIT model is a good starting point. It stands for permission, limited information, specific suggestions, and intensive therapy.
So permission is about creating a safe and open environment where the patient feels comfortable talking about their sexual needs.
And limited information is about providing basic information about how their illness or treatment might be affecting their sexual function.
And specific suggestions are about offering practical advice and recommendations tailored to the patient's specific situation.
And intensive therapy is about recognizing when the patient's needs are more complex and require referral to a specialist.
So the next model is the CARESS model. And this one really focuses on the importance of touch and the cyclical nature of sexual response in palliative care relationships.
Right. CARESS stands for counseling, assessment, research, education, strategies, and sustaining gains.
So counseling is about acknowledging and validating the disruptions that illness can cause in a person's sexual life.
And assessment is about understanding the level of intimacy between the patient and their partner.
And research is about considering any potential risks associated with physical intimacy.
And education is about providing information about how the patient's condition might affect their intimacy.
And strategies are about working with the patient and their partner to find new ways to be intimate.
And sustaining gains is about helping the couple to adapt to changes in their relationship as the illness progresses.
And one thing that both of these models highlight is the importance of avoiding what's called sexual reenfranchisement.
Yeah, that's the tendency to view people with serious illnesses as asexual, as if they no longer have any sexual needs or desires.
And this can be really damaging, both for the patient and their partner. It's like denying them a fundamental part of who they are.
Absolutely.
Right.
And it's especially important to remember that this applies to adolescents with life-limiting illnesses, too.
Right. They're going through all the same physical and emotional changes as their peers, and they have the same needs for intimacy and connection.
So it's really about recognizing that sexuality is a part of being human, and it doesn't just disappear when someone gets sick.
Exactly. And now let's move on to our final topic for today.
All right.
Spirituality.
All right. This is a topic that's close to my heart.
It's an important one, and it's often misunderstood.
So let's start with a definition. One of our sources describes spirituality as the way individuals seek and express meaning and purpose in their lives, and how they experience a sense of connectedness to the moment, to themselves, to others, to nature, and to the significant or sacred.
So it's about that search for meaning, that sense of something bigger than ourselves.
Exactly. And it's important to note that this doesn't necessarily mean believing in a god or following a particular religion.
Right, because sometimes spirituality and religion are used interchangeably, but they're actually distinct concepts.
Yeah, religion is more about organized beliefs and practices, while spirituality is more about that personal search for meaning and connection.
You know, I like to think of it this way. Religion is like a specific path up a mountain, while spirituality is more like the mountain itself.
I like that analogy.
And it's important to remember that people might find their own unique paths to spirituality.
Absolutely. And spirituality can become especially important at the end of life, as people start to reflect on their lives and grapple with their mortality.
Right. They might start asking big questions about the meaning of life, the purpose of suffering, and what happens after death.
And they might be searching for peace and acceptance in the face of their illness.
And a study of patients with advanced cancer found that some of the most common spiritual needs included overcoming fears, finding hope, discovering meaning in their lives, and wanting to talk about finding peace, meaning, and death and dying.
So it's important for healthcare providers to be aware of these needs and to be able to address them in a sensitive and compassionate way.
And one tool that can be helpful for this is the FICA Spiritual Assessment Tool.
Yeah, FICA stands for faith or belief, importance and influence, community, and address.
So faith or belief is about exploring the patient's beliefs and what gives their life meaning.
And importance and influence is about understanding how their beliefs affect their healthcare decisions and how they cope with their illness.
And community is about identifying any spiritual or religious communities that provide them with support.
And address is about thinking about how the healthcare team can incorporate the patient's spiritual needs into their care plan.
Now, sometimes it can be difficult to recognize when someone has spiritual needs.
Yeah, because they might not always express them directly.
Right. But there are some signs to look out for, like asking questions about the future, reluctance to talk about death, and even physical symptoms that don't respond to traditional treatment.
And even those fight, flight, or freeze responses we sometimes see can be indicators of unmet spiritual needs.
So, what can we do to provide spiritual care? Our sources emphasize the importance of compassionate presence.
Absolutely. It's not just about having the right tools or techniques. It's about being present with the person, listening deeply, and offering support without judgment.
And this can be expressed in many ways, like through artistic expression, complementary therapies, and simply being a calm and compassionate presence.
One of our sources talks about this idea of hearing of the spirit, which requires us to really empty ourselves and be fully present with the person.
And it's important to remember that we're working with people from many different cultural and religious backgrounds, so we need to be sensitive to their beliefs and practices.
Absolutely. And we might need to educate ourselves about different faiths and traditions so we can provide culturally competent care.
And our sources offer a brief overview of some of the major religions and their beliefs about death.
For example, in African traditional religions, there's a strong emphasis on community and connection to ancestors. Burial is seen as a vital step in joining the spirit world, and there are often elaborate mourning rituals involving the whole community.
In Buddhism, the focus is on understanding suffering, living ethically, and practicing meditation to achieve a calm and clear mind at death. Cremation is a common practice.
In Christianity, the focus is on the teachings of Jesus Christ and a belief in the afterlife. Specific rituals vary depending on the denomination, but often include visitation, a funeral or memorial service, and burial or cremation.
In Hinduism, there's a belief in reincarnation and the ultimate goal of reuniting with Brahman. Practices often include vegetarianism, the use of sacred symbols, readings from the Bhagavad Gita, and the belief that the person's last thought should be of God. Cremation is common, and there's a specific pattern for mourning.
In Islam, the focus is on belief in Allah and the afterlife. There are specific practices around washing the body and burial, which should happen quickly, usually within 24 hours. Cremation is not allowed.
And in Judaism, there's a strong emphasis on honoring the body and specific mourning rituals. Burial usually takes place within 24 to 48 hours, and the body is not left unattended until burial.
Another tool we can use to assess spiritual needs is the HOPE assessment.
Right, HOPE stands for Sources of Hope, Organized Religion, Personal Spirituality and Beliefs, and effects on medical decisions and end-of-life choices.
And it's important to be aware of the role of traditional medicine and healing practices in some cultures.
Yeah, for example, in African traditional medicine, illness might be seen as having spiritual causes, and traditional healers might address both the physical and spiritual aspects of a person's well-being.
And it's important for healthcare providers to understand these beliefs and to be respectful of patients who might choose to seek out traditional healing practices.
And it's interesting to note that research has actually shown that when people's spiritual needs are met, they often experience less pain, need less pain medication, and are more likely to be able to die at home.
Which really highlights how important it is to address this aspect of care.
Absolutely. And it's important to remember that you don't have to be a spiritual expert to provide spiritual care.
Right. Sometimes it's the simplest things that can make the biggest difference, like being present with the person, listening without judgment, and offering a comforting touch.
And Dame Cicely Saunders said that so much of the soul pain people experience can be healed by the way care is carried out.
That's a powerful quote.
It really is. So what are some practical ways we can offer spiritual care?
Well, we can be a compassionate and calm presence, listen deeply without judgment, be comfortable with silence, engage honestly with their questions, treat them with dignity and respect their beliefs, and allow for ambiguity and uncertainty.
And one of our sources tells a story about a patient who kept asking for a box.
Oh, yeah, that's a good one.
At first, the staff thought he meant a literal box. But through deeper listening, they realized that the box represented a sense of safety and control for him.
It's a good reminder that we need to pay attention to the language people use and try to understand the deeper meaning behind their words.
And sometimes dreams can also be a window into a person's spiritual or emotional state.
Right.
And there's a simple technique we can use to engage with dreams. We can listen attentively as the person tells us their dream, retell the dream back to them using their exact words, and then ask them how they would change the ending of the dream if they could.
That's a great way to help people to process their feelings and to find meaning in their experiences.
So as we wrap up this deep dive, I think it's clear that culture, sexuality, and spirituality are all deeply intertwined in palliative care.
Absolutely. They're all part of what makes us human, and they all play a role in how we experience illness, death, and dying.
And we hope that you, the learner, can take these insights and use them to provide more compassionate and holistic care to the people you serve.
And we'd like to leave you with a final thought. Imagine how we could transform the experience of end-of-life care if we consistently integrated an awareness of someone's cultural background, their sexual identity, and their spiritual needs into everything we do.
How much more peaceful and meaningful could that experience be, both for the person who is dying and for their loved ones?
We encourage you to think about what one small step you can take to be more attuned to these dimensions in your next interaction.
Thank you for joining us for this deep dive.
It's been a pleasure.